partial knee replacement?
A partial knee replacement is a procedure that replaces or resurfaces a particular compartment of the knee, usually the medial compartment. There are three compartments of the knee: medial, lateral, and patellofemoral compartments, but the vast majority of partial knee replacements involve resurfacing the medial compartment.
Okay. How long have partial knee replacements been around?
Partial knee replacements in concept have been around since the beginning of knee replacement surgery, going back to the 1960s. Some of the very early knee replacements involved giving the surgeon the option of replacing the medial or lateral compartment, or both. It so happened in this country that the total condylar design that combined both of the upper compartments and the two lower compartments became popular, and that took off in this country and became the mainstay through the 70s, 80s. But the concept of partial knee replacement remained, and in countries outside the United States refined the technique, refined the indications and the type of patient that was best suited for that procedure, and its popularity came back in the late 80s, 90s, and I think over the past decade has become a mainstay in orthopedic treatment of arthritic knees.
Okay. What's your personal experience using the partial knee replacement?
Well, some of the first knee replacements that I saw as a resident back in 1979 were a partial type knee called the old Marmor knee. Again, that was a type of knee that gave the surgeon the option of replacing one compartment or the other, or both. But by the time I finished my residency in 1984, the total condylar concept was the way to go, and indeed across the country, total condylar knees were the mainstay in orthopedic treatment of arthritic knees. Somewhere in the mid-90s, the popularity of partial knee replacements began to return as younger people that were perhaps considered too young to have total knee replacements required some type of treatment for bone-on-bone pain. So the partial knee did become repopularized, and I think particularly in line with a need for minimally invasive surgery. I think found a niche, and along came the Oxford knee in 2005, and partial knee replacements have really taken off since that time.
Okay. So you had mentioned a younger patient, but who is an ideal candidate for the partial knee?
An ideal candidate for partial knee replacement is a patient with arthritic disease that is confined to one compartment of the knee, usually the medial compartment. You cannot have inflammatory joint disease such as rheumatoid arthritis or gout. You cannot have ligament instability such as a chronic anterior cruciate instability or other types of ligamentous instability. Severe joint contractures, severe knee stiffness are also probably a contraindication to partial knee replacement.